One of the scariest things about the Wuhan coronavirus, one of the many reasons all of us have long been so afraid of it, has always been how little we know about it. Ebola, malaria, cholera, obviously those are dangerous diseases. They've killed millions. But on the whole, we understand them pretty well, the fundamentals anyway. We know how easily they spread. We know how deadly they are. This disease, by contrast, is entirely new. It's literally a novel coronavirus. Early accounts said the mystery illness coming from central China could be transmitted far more easily than the flu, and that the death rate was remarkably high. Some reports suggested it could kill 2, 3, 5, even 8% of all those who got it. Worst case scenarios predicted millions and millions of people would die. The public was horrified. They still are. But how afraid should they be? Many people are still dying in this pandemic, including here in the United States. Beyond that fact, we still don't have the numbers we need to fully understand what's happening around us. Too few people have been tested. And yet, as of tonight, there are some suggestions of good news. We want to bring them to you. Here's one. Between March 22nd and April 4th, a total of 215 pregnant women delivered babies at New York Presbyterian Allen Hospital and Columbia University Irving Medical Center. Every single one of these women was screened for the coronavirus. It turned out that 33 of them had it. That's more than 15% of the total group. Of the infected, 29 of them, that's about 88% of them, were totally asymptomatic. So think about what that might mean if we extrapolated it citywide. As of April 4th, New York had more than 60,000 confirmed cases of the coronavirus and a little over 2,200 deaths. If more than 15% of New York's population was infected, that would suggest a total of 1.3 million cases in New York, with only about 150,000 of them showing symptoms. In other words, the virus would be far more widespread than we expected it to be, but also far less deadly than we expected. The actual death rate would not be 3 or 4%. It would be closer to 0.2%. That would be great. Now, we don't know for certain that's the case. 215 people is a small sample, and in this specific case, it's not a representative sample. Hospitals are major vectors for the transmission of coronavirus. Pregnant women tend to spend a lot of time in hospitals. Pregnant women are also younger and healthier than most people, so it's possible they're also less likely to exhibit symptoms of the virus. We don't know. On the other hand, this is not the only study that suggests these trends. In Scotland, researchers tested 500 people 3 weeks into the outbreak there. More than 1% tested positive for antibodies to coronavirus. That is 12 times greater than the confirmed caseload in that country at that time, 12 times more. In Denmark, a little over a month into the outbreak, only 0.1% of the population was infected, according to official numbers. And yet a screening of 1,500 people found that 2.7% actually had antibodies. That would mean the true death rate from coronavirus there might be 1/27th as high as they thought it was. Meanwhile, in Germany, the official death rate from the coronavirus stands today at about 2.5%. That's a horrifying number. And it may be real. On the other hand, in the town of Gangelt, where large-scale random testing has been performed, the death rate was found to be just 0.37%. That's a fraction of the official numbers, barely 1/7 of it. So all of this is very encouraging news. If the infection is more widespread than we thought, by definition, that means the virus is less deadly. That would mean our burden on the healthcare system would be lower than we expected it to be. And in fact, we are seeing that. It would also mean that coronavirus may be closer than we knew to running its course. It would mean an awful lot of people have already been infected with it and then recovered without even knowing it. And those people could pause and let relief sweep over them and then get back to their lives. Above all, if this is true, if these trends hold, it would mean that the rest of us could be slightly less terrified going forward. Yes, this is awful. Yes, people are dying. Yes, they will continue to die here in the U.S. But it would not quite be the plague we thought it was. And that might give us some perspective. We could begin maybe to think clearly again. Most of us want all of that badly. But do our leaders want that? Sometimes when you watch them, you begin to suspect they're secretly enjoying our fear. Dr. Jay Bhattacharya is a Stanford University medical professor. He's been investigating the death rate from coronavirus, a fascinating and important number, and he joins us tonight. Doctor, thanks so much for coming on. What are you concluding about the real death rate, the actual death rate from this virus?
I think based on the evidence I've seen so far, it's likely orders of magnitude lower than the initial estimates. The World Health Organization put an estimate out that was, I think, initially 3.4%. It's very unlikely that it's anywhere near that. It's much likely, much closer to the death rate that you see from the flu per case. The problem, of course, is that we don't have a vaccine. So in that sense, it's more deadly and more widespread than the flu.
Right.
And it overwhelms hospital systems in ways the flu doesn't. But per case, I don't think it's as deadly as people have thought.
I know that it's very hard to come up with any kind of firm numbers in the absence of widespread testing. But do you think it's likely that there are large numbers of Americans who've been infected, recovered, and didn't know it?
Yes, I believe that is true. In fact, we're going to start to know that very, very soon. I've been working on studies with some colleagues of mine in Santa Clara County, in Los Angeles County, and then also a large nationwide study working with Major League Baseball employees, not just athletes, but all the employees. Very soon, we're going to have, I think, a much more accurate understanding of how widespread this is. And then we'll, as you said it very well in your introduction, we'll also know much better how deadly it actually is. Evidence from around the world is flowing in, and it really seems like there's many cases of the coronavirus that we haven't identified with the testing regimens that we've had around the world. Many orders of magnitude more people have been infected with it than I think that we realize, and that, as you rightly pointed out, means that the death rate is actually lower than people have realized, also by orders of magnitude.
So one of the destructive byproducts of this pandemic is fear, which is itself, I would say, it clearly is hurting people. You're an American, in addition to a physician and a researcher. Based on the research that you have done, are you more afraid or less afraid than you were when you began?
I'm less afraid than I was when I began. I think, I mean, I've heard so many stories of people who can't hug their grandkids. We're scared to hug because they don't want to get the virus from their kids because they're older. I've heard lots of stories of like husbands and wives that won't hug each other because the wife is a nurse and the frontline worker. I think this understanding really the true death rate. If the death rate's somewhere near 1 in 1,000, would you not hug your wife? I mean, if it's 3 in 100, you act very differently than if it's 1 in 1,000. So I'm hoping once we get accurate numbers in place, we'll be able to really sort of quell the fear that's out there.
Boy, that is one of the most reassuring things I've heard in a long time. Doctor, thank you truly for coming on tonight. I appreciate it.
My pleasure.